back in the early 60s is when Kennedy deinstitutionalized the state hospitals. Prior to that, people with mental illness were really in the state hospitals, largely. And so that created the community mental health centers. So we're talking late 50s and 60s is when that change started. When I started in mental health, it was the mid-80s. And at that time, some medications had really started having an impact, and individuals were being able to come out of the state hospitals and actually live in the community. They were able to live in group homes, but they were also able to live in their own apartments. And that was huge. I mean, that was a big deal at that time. At that time, everybody's goal was to keep that individual stable. We don't want anything, any stressors, we keep them in a nice bubble where they're safe and stable, and maybe they won't have to go back to the state hospital. At that point in time, it didn't take much for an individual to have to go back to the state hospital. So that was our goal. Well, over time, medications got better, the treatments got better, we all got wiser, started to understand mental illness more. And in the early 90s, Voc Rehab decided it was time to engage the mental health centers in providing employment services for the individuals that they serve. Prior to that, either you did it on your own, you created your own programs in-house, or perhaps you had a DD provider who was willing to work with your clients with Voc Rehab. Otherwise, there really wasn't that option. So Voc Rehab was the one that approached, along with DMHA, Department of Division of Mental Health and Addictions, approached the mental health centers and said, hey, let's do this. Why don't you guys become providers of services? And so through the years, since the early 90s, the mental health centers have really developed into strong providers serving what's considered one of the largest disability populations of our Voc Rehab program. And we've had amazing successes. When we first approach an employer, unless they have had a good experience with an individual with a mental illness or a substance abuse issue, they tend to be a little intimidated, concerned, reticent about hiring someone with a mental illness. If they've had a good experience, then usually they're more open to it. So oftentimes what we have to do is provide that opportunity for them to have that good experience. And once they've had that great experience, you know, they usually are incredibly happily surprised and committed to that individual and anyone with a mental illness, because their idea of what mental illness is usually whatever the media has shown and not necessarily factual or real. And so getting to know an individual who just happens to have a mental illness makes all the difference in the world. So it's really an approach of building that relationship, and then you build that community, because then that employer is an advocate. This person becomes not an individual with a mental illness, but one of my best employees, and therefore I want more best employees like this person, and it really gives that opportunity for more individuals, more businesses to hire, more employers to hire. There are a lot of big companies that are starting initiatives to integrate workforce. And so the job for the mental health centers, of course, is to really push for that integration as well. Well, we have these individuals over here that have mental illness, and they can do jobs too. So let's get them into your picture when you think of integrating disabilities into your workforce. Let's make sure you include the individuals with the mental illnesses, because they're great employees as well. And so that has opened up a number of large companies where before, if it was geared towards just the manager making that decision, you have some managers who are great and open to hiring individuals with disabilities, and then you have others who are not. If the corporation has an initiative, then everybody gets to get on board, and that opens so many doors for everyone. Clients who have never worked, and some of them were in state hospitals, so they actually did have their time in the state hospitals, and then they came into the community, and it may have been 10 or 15 years since they were even possibly ever going to work. And they take a look at things and they decide, you know, I would like to have a little bit of extra money, and yeah, I'd like to try this employment. And we are able to get them jobs, and sometimes the job may or may not last a long time, but it's never a failure because it's like the rest of us. We get to try things and get better at it every time. And so for an individual to take that big risk the first time, rather they stay on the job for 3 months or they stay on the job for 3 years or 30 years, it's a success, and that's an important thing to look at. I think, again, in our society, you lose a job, it's a failure. Well, no, it isn't a failure. In this case, it's a wonderful success. So we have clients that have been in the state hospital, then maybe they move into a group home, and they reach a certain level of independence, and then they move into their own apartment in the community. And at any point in there, once they leave the state hospital, they get a job. It's fantastic. The trend is going to be to continue to change our funding, to change our treatment approaches, to make them all recovery focused, which is a partnership with the client versus the I'm the expert, you need to do what I suggest you do. So that's going to be a huge shift. We're going to continue to see that. You know, that ship is turning now, but it still has a long ways to go. So that's going to be one of the trends. And then I think because of recovery, we're going to see more and more individuals get jobs and hold jobs and keep them long term. Medications are continuing to get better and better, and some have less debilitating side effects. So I think that will enable folks to really find out their potential. When you consider who was actually coming forward in the early 60s and saying, I have a mental health issue, the risk of being put in a state hospital was probably always there. So that voice probably wasn't heard as much to today, when there are so many advocacy groups and so many folks that are making an opportunity to educate individuals in our communities about mental illness, and every family is touched by mental illness or substance abuse. I mean, there isn't anyone that you run into anywhere who hasn't had to deal with friends or family or themselves with mental illness, depression, anxiety, schizophrenia, bipolar disorder, substance abuse. It's everywhere, and so everyone has experience, and everyone's experience is a little different.